Welcome back to County Connection. Our guest for this next segment is Dan Hendershot, who is the Environmental Health Manager in Summit County Public Health Department. Welcome, Dan.
Thank you, Julie.
So with summer hopefully right around the corner, the environment is changing a little bit, temperatures are changing a little bit, and with those changes come some heightened risks in terms of some health issues out there. And so a lot of these health risks have to do with wildlife and animals that we see that we may not encounter during the wintertime.
Yep, zoonosis, right? Everybody knows that word, right?
Right, zoonosis. It's my new favorite word, actually. Can we put it up on the screen? Zoonosis.
Yeah, it's not zoonoses, zoonosis. It's diseases that humans acquire from animal hosts.
Okay.
Is kind of what that term means.
Okay, great.
Yeah.
And so to kick it off, one that people have certainly heard of, but maybe don't know the details in terms of how to protect themselves from it, rabies. Tell us about rabies.
Yeah, rabies is a very serious illness, as most people know. Most people have seen Cujo or Old Yeller or something like that and have an understanding of the disease. There's only been 2 people that have survived rabies once they start showing symptoms and have had no history of treatment in the past, such as vaccination. So it's a very serious illness. What people don't commonly know is it's commonly found in our bat population. Statewide, we figure it's in about 1% to 2% of the bats. And so if you're finding a bat in your home, especially if it's acting strange, such as walking on the floor, bats don't walk, they fly, you know. If it's flying around during the day, bats are nocturnal. That's kind of weird behavior. If they're attacking you, that's weird behavior. Bats don't like to interact with people. So a lot of times people wake up with a bat in their bedroom even, or in their kid's bedroom. It's a very, very serious consideration there on whether or not there was a potential exposure, whether you need the prophylaxis medication. And so we encourage anyone when they find a bat to try to safely capture it, believe it or not, so we can test the bat and avoid the question of whether prophylaxis is necessary. The chances of you acquiring the rabies is pretty slim, but the risk of you dying if you do get it is extremely high, and you really can't see the bite when they do bite you. It's very, very slight.
That's interesting.
Yeah.
And if you do get that prophylaxis, then that's very effective, but the trick is getting it soon enough.
Yep, that's right. You have to get it within a certain period of time, and I don't remember exactly what that time is, but if you catch it early, you get that prophylaxis and you won't acquire the disease. As far as avoiding the disease, the main thing to do is vaccinate your pets. We've not only seen rabies in bats and those mammals, but also in terrestrial animals or ground animals. It's been on the Front Range a lot in skunks primarily, but we've seen it in all kinds of animals, even mountain lions. I can't imagine a rabid mountain lion, but someone had one in their garage. Wow. And so it's kind of becoming more prevalent in Colorado, with hundreds of animals showing up positive for rabies. So we need to be careful.
Right.
The other thing is
that barrier of your pet being vaccinated.
That's
and
right.
Kind of so they're not interacting, having a wildlife interaction, catching rabies and passing it on to you. Yeah,
it's hard to teach your cat not to interact with a bat. They just naturally want to do that. And so you can teach your kids and yourselves, but that's why we would recommend vaccination of those pets. I believe it's law, but I'm not sure about that for cats. I think all dogs have to be vaccinated though, so probably a more appropriate question for animal control.
Sounds good. And then we actually have seen some rabies concerns in Summit County specifically.
That's right, yeah. We're immune to a lot of diseases in Summit County because of our colder climate. We don't have quite the insects that some areas do and that sort of thing. But we found a positive bat about 3 years ago north of Silverthorne. Some folks were around camping, and the bat during the middle of the day was attacking one of the persons, latched onto his back. Yikes. Another person in the party killed the bat. And both of those individuals, it ended up getting the prophylaxis and all was good. Another one several years ago, a bike rider in the 10-Mile Canyon was riding, similar situation. A bat was attacking him in the middle of the day, and that bat too came up positive for rabies. So it's definitely a concern here. We have not seen it in our terrestrial animals yet.
Okay.
Hasn't made it over the divide, but it likely will soon. And those animals interact with pets a little bit more than bats do, so that will heighten our risk a little bit more when that happens.
Okay.
Yep.
All right, so let's move away from bats and head into rodents. What's a disease? Tell us about the concerns surrounding rodents.
Sure, yeah. A big one is plague. And when you think of plague, again,
you think of the Middle Ages.
Yeah, the hair stands up on people's backs a little. Bubonic plague, black plague. It's believed to be the same plague that was in the Middle Ages in Europe and wiped out a good portion of the population. And plague is commonly found in our prairie dogs, our ground squirrels, and different things like that in the state. I don't believe we've had any test positive in Summit County, but we have every reason to believe it's here as well.
Okay.
Last year we had several human cases of plague. A dog in the Front Range was interacting likely with prairie dogs and that sort of thing. They get the fleas bite the dog gets it, the dog gets sick and forms what they call pneumonic plague, and then the plague can be transmitted through aerosolized methods, just like the flu.
Okay.
So the dog went to the
respiratory.
vet. That's right. You sneeze and that sort of thing. So it becomes very contagious at that point. So the dog went to the vet. 3 of the owners became symptomatic and were diagnosed with plague, and the vet tech all survived because they caught it and got the treatment. But the point there is good advice not to let your dogs wander off leash to where they can interact with those sort of animals. Don't get too cozy with your pets. Sleeping in your bed is our advice, that you don't let your dog sleep in your bed, because they might get fleas that would then jump to a human and cause illness in the human that way.
Okay, and what are the symptoms of plague?
Yeah, the symptoms of plague, and I'm going to look because they all start out with flu-like symptoms typically.
Okay.
So plague, let's see, let me get to the right page here. Let's see. Flu-like, then it depends. If you get a bubonic plague, that's usually from the bite of a flea, and you'll get swollen lymph nodes in different parts of your body that are very painful. Septicemic plague gets into your bloodstream, and that gets very serious. And then pneumonic plague resides in your lungs, and you develop a pneumonia, and so that's the one that's transmitted person to person very easily. So it varies depending on the type that you have.
Gotcha. All right, and then another disease that is carried by rodents is hantavirus, which has been in the news over the past few years a fair amount. Yeah,
hantavirus is another very serious illness that we have every reason to believe exists here, although we've never documented it here. We have the deer mice that transmit the hantavirus. And so what happens with hantavirus is spring cleaning comes around, folks go into their shed and whatnot and have rodent droppings that have accumulated there. It's a very dry environment. They start sweeping up the droppings, and what happens is the virus is in their feces, urine, and in their droplet from their saliva, and so it becomes aerosolized. They breathe it in and they get hantavirus, and statistically 40% of people that get hantavirus die. This year, the latest I know is we've had 3 people in Colorado with hantavirus, and all 3 have died.
Already this year.
Already this year, so it's a very serious illness. We've had hantavirus in most of our neighboring counties, so we have every reason to believe it's here. It's not immune to our high altitude environment, so people need to take precautions. And we have good cleanup guidelines in our on our website. CDC has good information and such. But basically, you want to ventilate an area very well. If you find rodent droppings, you don't want to sweep them, you don't want to vacuum them. You want to wet them with a bleach solution, about 1 part bleach to 9 parts water. Let it soak for 5 minutes, don a mask and potentially eye protection, and then wipe it up with a paper towel, throw it away. Any dead rodents that you come across, same thing, spray them with bleach water, let them soak, and then double bag them and throw them away. So that's the main thing. You know, I don't want to be Downer Dan. I've been called Downer Dan before. Don't go outside, you know, stay in your bubble. The main thing is just awareness on these things, and you should be able to avoid most of these. And the other thing is early detection. So if you know you've been exposed to some of these critters out there, or insects, you can communicate with your doc that I was in my house cleaning up these rodent droppings, and now I've got an upper respiratory infection. I wonder if I might have Hantavirus, doc, and that can really help them in their diagnosis and early detection and treatment.
Right, so just being educated about the possibility is helpful.
Absolutely, yep. Another disease that's carried by rodents that has gotten the attention of public health folks recently is one called tularemia.
Right, we've had some alerts, was it back in this fall?
Fall, yep, that's right. So last year I believe we had 16 cases of tularemia in the state, and normally we have less than 4 or 5 in the state. So we really saw a big spike in tularemia. Typically it's called rabbit fever. Folks are out hunting rabbits, you know, and they nick their finger, and then they get a skin ulcer at that site. Fairly easy to treat. Where it becomes more serious is when you inhale the bacteria. It resides in your lungs and develops a pneumonia, and that can be pretty serious. And a lot of the cases we saw last year were just folks out riding their bike, gardening, different things like that, where they were exposed to the bacteria in the ground, or dead animals that they might have found and picked up. We had 2 beaver that tested positive for tularemia in Summit County. So it's definitely here. So again, just getting early detection. It is a bacteria, and so antibiotics, I would guess, are pretty effective with it. But at that point, we would refer to your medical provider to really help you with that.
All right. So let's see. So we've covered the rodent order, I believe.
I think so,
of the animal kingdom. So how about let's move on to insects.
There's a few insect-borne diseases. The most notable is West Nile virus. Everybody's heard of West Nile virus. Transmitted by the mosquito. And the interesting thing with West Nile virus, it's been in the United States for about 12 years now, and we've never had a locally acquired case of West Nile virus.
Here in Summit County?
Summit County, Colorado's been a very hot spot for West Nile virus. Thousands of cases back when it first came to Colorado, and even last year we had hundreds of cases. And a few deaths. It's a serious illness. But the problem is you need a very long summer and you need hot conditions, and the mosquito that transmits the West Nile virus, we sample for mosquitoes up here and we don't find it. At the very end of the summer, we might find 1 or 2 in Heaney area or something, lower elevation, you know, but we just don't have the mosquito that transmits it, fortunately. So the prevention tactic with West Nile virus is stay in Summit County in July and August, and even a little bit into September. There's no reason to leave then anyway, right? But if you do happen to find yourself visiting family in Denver area or something, or heading out for a bike ride somewhere, you know, using a good mosquito repellent, we usually recommend DEET sparingly. Donning yourself with long sleeves, long pants, not going out at dawn or dusk potentially when the mosquitoes are more active. All right, so I think that hits all the ones that we were going to highlight today. But as you mentioned, there's a lot to know about prevention and which animals carry which diseases. So why don't you give us some general guidelines about wildlife interactions in order to prevent
zoonoses.
Sure,
Zoonosis.
sure. Yeah. So one good tip is to not store your wood pile close to your house. A lot of times people like to put the pile right next to their house so that they can easily go out and grab some wood and not get, too snowy in the middle of winter. But wood piles can be harborage not only for spiders, which can be a whole nother concern, black widows namely,
Okay.
but also with rodent harborage. They love those wood piles. And so keeping those away from the house. We generally wouldn't encourage folks to have bat boxes, at their place of residence, that kind of thing. But
is that something that provides a little home for a bat?
Yeah, it's kind of like a birdhouse for bats. But I understand that, some people really like to have a bat box at their house. And so our recommendation is that you not mount it to the house, mount it at least 100 feet away from the house, particularly if you have kids and that sort of thing. And then another thing that we like to highlight is just trash management. It's a real problem in Summit County. We've all had neighbors that, put the trash out 5 days before it's due, the weekend warriors, and leave on Sunday, and trash doesn't come till Thursday, and inevitably you end up with trash strewn all across the neighborhood. And that can not only attract rodents and insects and birds and different carriers of these sorts of diseases, but it can also present a hazard for bears, and we're interested in protecting the bears, keeping the bears wild, and so be good about keeping your trash under lock until trash day, so that doesn't become a nuisance.
Definitely.
Yeah.
All right. Well, thanks, Dan. This has all been super interesting and very helpful as we're looking forward to having a safe and healthy summer.
Yeah, absolutely. Hopefully it'll come around one of these days.
Right? Yeah.
Monday's looking good, hopefully.
Pray for sunshine. All right. And then why don't we finish off by, if you could remind us some of those resources you talked about where people can review some of the information that you presented today and maybe get some more detail.
We have a little bit of information on our website, but we try to be efficient with our time, and we can't be experts in everything. And the CDC has great information on their website, as does the Colorado Department of Public Health and Environment. And so I would encourage folks to go to those websites, and we have links to those websites from our website, and then hopefully we can get that up on the screen for folks to do their own research and learn more than what we have time to cover today.
All right, that sounds great. Thanks so much for coming in and sharing all this info with us.
My pleasure. Thanks for having me.
You're welcome. And for those of you at home, we're going to take a quick break, and when we come back, we're going to talk about swiftwater safety as we go through the spring runoff.